Hello again, everyone. This is Eliza Wallace. The chapter that I chose is Chapter 11, The Endocrine Disorder. Since our patient is a 24-year-old male who is a heroin addict, the topic that I will be talking about is the effects of diabetes on drug addiction. Alex is one of the fortunate patients to realize that he had a destructive substance abuse problem on top of his diabetes. But he was motivated to change and was willing to seek help. Drug addiction support and recovery happens not only in a treatment facility, but in the daily life of an addict after they leave. It involves creating a new life based on principles that promote sobriety, acceptance, health, and well-being. In order for diabetics with drug addiction to get healthy and stay sober, they need to understand the complex and dangerous relationship between their conditions. What is diabetes? Diabetes mellitus is a long-term health problem. Diabetes is a metabolic condition characterized by chronically high blood sugar levels. It means that your body does not make enough insulin, or it may mean that your body cannot use the insulin it makes. Insulin is a hormone in your body which normally diverts glucose from the blood into the cells. All of your cells needs glucose for fuel. When you have diabetes, the glucose in your blood builds up because it cannot get into the cells of organ and muscle tissues. Types of diabetes. Diabetes doesn't just refer to one disorder, but includes type 1 diabetes, or also called as insulin-dependent diabetes. This occurs because there has been a loss of insulin-producing cells in the pancreas. This can lead to a situation where there is little or no insulin being produced. This condition most often first gets diagnosed in childhood, and this is why it is also sometimes referred as a juvenile onset diabetes. Those who have been diagnosed with type 1 diabetes will need to take insulin shots or use an insulin pump in order to control their blood sugar levels. Type 2 diabetes usually occur later in life, and this is why it is sometimes called as the adult onset diabetes. With this condition, the pancreas is usually able to produce at least some insulin, but the cells have become more resistant to the hormone. Type 2 diabetes is often said to occur because of poor lifestyle choices, especially diet or alcohol abuse. Most doctors believe this is to be the reason why type 2 diabetics tend to be overweight or obese. Many people with diabetes take medication instead of insulin injections, and that is why it is also referred to as a non-insulin dependent diabetes. Symptoms of diabetes. It is possible for people who are developing diabetes to not have any noticeable symptoms. The most usual symptoms that people experience with diabetes are listed below. Unexplained weight loss makes up 81%. In people with diabetes, insufficient insulin prevents the body from getting glucose from the blood into the body cells to use as energy. This causes the body to start burning fat and muscle for energy, causing a reduction in body weight. How to diagnose diabetes. The American Diabetes Association suggests the following glycemic goals which may be appropriate for each individual. An A1C of 7%, or A1C, which is also reported as EAG of 154 milligrams per deciliter. The American Diabetes Association, since 2003, uses a slightly different range for impaired fasting glucose of 5.6 to 6.9. A positive result in high blood sugar should be confirmed by a repeat of any of the above methods on a different day. It is preferable to measure a fasting glucose level because of the ease of measurement and the considerable time commitment of formal glucose tolerance testing, which takes 2 hours to complete and offers no prognostic advantage over the fasting test. 2 fasting glucose measurements above 126 milligrams per deciliter are considered diagnostic for diabetes mellitus. The dangers of drug addiction in diabetes. Drug addiction is painful enough on its own, but it causes even greater difficulties for people with diabetes. Diabetic addicts risk even greater damage to their bodies than other drug users. Using drugs can worsen their ups and downs in blood sugar, leading them to overeat and further blunt their insulin sensitivity. Both of these extremes can be damaging for the body. The potential complications of diabetes are listed below. Diabetic ketoacidosis is a medical emergency and occurs when the body reacts to a shortage of insulin by burning up fatty acids. This leads to a rise in ketones, which can lead to death if not treated right away. Blood sugar and drug cravings. Although diabetes is a disease of high blood sugar, diabetic addicts who treat their conditions often experience abnormally low levels. Since they either can't produce insulin or can't use it efficiently, they usually inject large amounts of it after meals. These injections can lead to the rapid uptake of glucose in their bodies, leaving them with extremely low concentration of blood sugar called hypoglycemia. Low blood sugar tends to induce hunger in healthy people, but the body feedback mechanism for food and drug cravings are intertwined. Most diabetic addicts who become hypoglycemic will feel strong urges to get high, and diabetics may have this experience multiple times per day. Illegal drugs may counteract or reduce the effectiveness of medication that people with diabetes use to maintain healthy blood sugars. Complication due to drug use that leads to hyper or hypoglycemia can result in a coma or death of a person who has diabetes. The current study suggests that roughly 95% of alcoholics are chronically hypoglycemic. Heroin and diabetes. Heroin in particular is a highly dangerous and addictive depressant that is typically bought on the streets. Similar to other depressants, it alters eating habits and hormone production, making it harder for the body to maintain healthy blood sugar levels, even when a diabetic is taking insulin or diabetes pills. Additionally, harmful effects are listed below. People who have diabetes are already highly susceptible to blood vessel and organ damage, ulcers, and amputations due to circulation problems. Taking drugs such as heroin causes extensive damage to the body that a diabetic would struggle to recover from without intensive substance abuse treatment. Checking your blood glucose. Blood glucose monitoring is an important part of diabetes care. It is the main tool diabetics need to have to check diabetes control. Self-testing their blood sugar is important in managing treatment plan and preventing long-term complication of diabetes. They can test their blood sugar at home with a portable electronic device that measures sugar level in a small drop of your blood. Keeping a log book of your result is vital to have a good picture of your body's response to your diabetes care plan. Materials needed when checking blood glucose are listed below. Regular glucose monitoring is one of the ways people with diabetes can learn more about their condition. When it's time to make important decisions about medication dosage, exercise, and diet, knowing your blood glucose levels will be a major help for you, your doctor, and the rest of your healthcare team. Giving insulin with a diabetes pen. Insulin shots with traditional regular syringes and needles are not as painful as most people think. Although using diabetes pen or insulin pen are ordered by the physician nowadays and are more preferred in giving insulin shots to oneself because they are more comfortable and convenient. Other advantages includes there's no need to draw the insulin from a vial, doses can be easily dialed into the pen, and it can be used for more insulin types. Materials needed when using insulin pens are listed below. Procedures on how to use an insulin pen. First, prepare the insulin pen. Check your pen to make sure it is the right prescription. Your doctor should have given you a prescription for both the pen and the needles. Second, remove the outer needle cap. Never reuse a pen needles for an injection. Third, prime the pen. Hold the pen with the needle pointing towards the ceiling and tap the pen to force any air bubbles to the top. Priming the pen will get rid of bubbles before giving the shot. Fourth, select the dosage amount. This allows you to control the amount of insulin you inject. Fifth, choose where to give the insulin shot. Common injection sites are a good layer of subcutaneous fat located at the abdomen, the thighs, the buttocks, or underneath the upper arm. 6. Give yourself the shot. Place the needle against your skin fold at either a 45-degree angle for at least 10 seconds. Last, dispose the needle. When it is full, tape the disposal container needle shut and dispose appropriately in a health product disposal site. Management of diabetes. Diabetes is a chronic disease for which there is no known cure except in very specific situations. Management concentrates on keeping blood sugar levels as close to normal without causing low blood sugar. This can usually be accomplished with a healthy diet, exercise, weight loss, and use of appropriate medications. Food is an important tool that can be used to control diabetes and stay healthy. Eating well-balanced meal in the correct amounts will help control blood glucose level and prevent low-high blood sugar reactions and reduce the health risks of diabetes. Usually, a registered dietitian will create a tailored diet approach that is just right for the diabetic patient. Learning about the disease and actively participating in the treatment is important, since complications are far less common and less severe in people who have well-managed blood sugar levels. The goal of treatment is an HA1C level of 6.5%, but should not be lower than that. Attention is also paid to other health problems that may accelerate the negative effects of diabetes. This includes smoking, alcohol, elevated cholesterol level, obesity, high blood pressure, lack of regular exercise, and in our patient's case, heroin and other recreational drugs. Specialized footwears and compression socks are widely used to reduce the risk of ulceration or re-ulceration in at risk of a diabetic feet. Drug addiction is always a dangerous disease, but it can be especially more life-threatening for people with diabetes. Support programs happens not only in a treatment facility, but in the daily lives of an addict after they leave. Overall, diabetes and drug addiction can easily exacerbate each other in a deadly cycle. Again, this is Eliza Wallace. Thank you for watching, and I can't wait to watch your video.